All right, let's bring you back now to one of the stories we have brought to you. And this is the continuation to reaction on the Section 59's preliminary investigations revealing that medical schemes in the country discriminated against black healthcare professionals in claims for money allegedly owed to them. Let's get reaction to this now, and we speak to Dr. Donald Gumede, chairperson of the National Healthcare Professionals Association. Dr. Gumede, good evening to you. Thank you very much for your time. The understanding is that the Section 59 panel today released what it says is its final report, and this report concludes that indeed there has been racial discrimination against black healthcare providers. How do associations like yours react to such a finding?
It's a relief that actually the panel found that our allegations were actually correct, because indeed they were correct from the beginning. Hence, we actually went to the Human Rights Commission as well, and to report this matter, because in this, democratic dispensation, we still have these racial tendencies from organizations, pointed at the color of your skin, of which that's very bad, to be honest, in our country, because we thought that 1994 brought democracy where the trade field or the professional field is leveled, or is going to be leveled, but it wasn't.
Yeah.
And when we actually made these observations, we were told that we are hallucinating. We are actually not in the reality realm by those three medical schemes. And to add salt to the wound, one of the medical aid who actually took our association actually to court on a Sunday, if I'm not mistaken. The courts have to be open, trying to block the interim report, actually that became now the final report. It was a government medical scheme. So imagine you are fighting against your own government, which actually is supposed to be in power to empower you.
Yeah.
They're trying to block racial discrimination that is happening. That is a sad thing, to be honest with you.
Yeah. When you say racial discrimination, when you at the initial stages were saying that there is racial discrimination here, please look into it. Give that to us in practical terms for the viewer who may not understand what went on. Give us a few examples of that discrimination.
Yeah, okay. So as one of the probably maybe now at that age senior members in the profession, we used to receive lots of complaints from our healthcare professionals who actually said, I'm visited by undercover spies. These guys, what they were doing, they were wearing cameras to come to your practice and try and solicit some kind of irregularities from you as a professional. And even if you refuse, they will insist, some of them, and to say, no, you must do 1, 2, 3, or you must give me a sick note, even if you tell them, I can't give you a sick note because you're not sick. Or then they said, others, they will say, no, we want to bring another patient under my name, is my sister, I don't have money. He says, no, I'll only treat the people who are in the medical aid, and all that. And these were done by the schemes. So they started a system, actually, or undercover or covert system, which actually they were trying to lure healthcare professionals to commit a misdemeanor, if we are to call it that way.
Yeah.
And then after that, they will sit with that information, which they recorded for 5 years. Then after 5 years, they will call you into the head office and say to you, you see, Dr. Gumede, we have proved that you gave Mr. X a sick note and he was not sick. And we have got evidence to that effect. And then we want 2 million from you, or we want 1 million from you. That's why Advocate Nugatobi was saying that, you see, when they make you sign this acknowledgement of debts, majority of the practice is either you go insolvent, because you'll be paying for another debt, and then you still have to maintain your own practice, which was not practical, and it was not possible. And then majority of the healthcare practitioners, I even attended funerals of healthcare professionals who committed suicide because of this tendency that I'm talking about. It's a reality that was happening. And now when we raise this issue that, no, there is a problem here, because the medical aids cannot be a police officer, they become the prosecutor, they become the judge, and they become the prison officer at once. And that's why in the recommendations of the report that actually I attended today with the minister and the advocate, senior advocate, when the presentation was done to us, is that we need a tribunal, an independent body that actually can gather the evidence and listen to both sides of the story and make a determination whether there was fraud committed or not. And we are not by any means saying that maybe there are no crooked individuals probably in the health spectrum, but the way in which it was done and the magnitude aggression that these guys were doing, I mean, it was a money-making scheme more than actually trying to deter all those probably were doing wrong in the field.
A final question, because we're out of time, and before I get there, I just want to read, for the benefit of the viewers, some of the findings that this panel concluded on. For example, in 2014, they're saying black dental therapists under the GEMS medical scheme, this would be a government medical scheme, were about 3 times more likely to be investigated and found guilty of fraud. In 2017, black psychiatrists under Discovery were about 3 to 5 times more likely to be investigated and found guilty of fraud. I'm just highlighting this as a way of enriching some of what you have said. Final question, therefore. Advocate Mugaitobi, the person who was leading this particular panel, says that they are not a court of law, but what they did have power to do was to make findings of fact. Do you wonder whether this could be taken on legal review by the medical schemes, some of whom I have mentioned here?
Correctly so, because even the health market inquiry report, as you will remember, you know, it actually marries the Section 59 report, if you look at it, to be honest with you, because it's just a continuation of actually what happened in the health market inquiry, and then you add this one. And even the minister said it actually in that meeting, to say the problem is when we start the implementation as the government, that's when these medical aids are going to jump and go to court and try and fight but you know, it's no brainer. Why would you want to sustain a system that I've just explained to you, where you are the police officer, you are the prosecutor, you are the judge and the prison warden? I mean, in which society do we live in? I mean, it doesn't make sense. It doesn't take any genius to see that the system is flawed. And it needs to be corrected. So, I mean, we need actually aggressive action, because like I always said, in this country, we have so many reports, but because these guys have got more money than the average person on the street, they flex their muscles. That's why Advocate Mugaitobi said the balance of power is not appropriate.
Dr.
Because
Gumede?
they have more money, they can just stop paying you, and then you'll close shop. And actually, as I'm talking to you now, even after the preliminary report, which actually has these recommendations, was published, they continued harassing healthcare professionals even up to today. I can send the list of the people that actually are still following them up, demanding money, that they must sign acknowledgement of debt.
Dr.
So
Gumede,
actually, this country is run. Yes, sir.
I apologize for this. I'm completely out of time, but I think you've made the point crystal clear. Thank you very much for making time for us. Dr. Donald Gumede, chairperson of the National Healthcare Professionals Association.